My good friend John Shadegg, Congressman from Arizona, and may I say you will forever be on, well, my honor roll, because you were actually one of the few Republicans after I left that kept fighting for the things we fought for when Republicans believed in small government. But secondly, we had you on here, and you predicted the TARP bailout would be a nightmare. Because it was 3 pages, it was too general, and it was the work of arrogance.
Yeah, a lot of arrogance.
So,
it's a wholly owned subsidiary.
Are Republicans a wholly owned subsidiary of health insurance companies?
I think it's actually a stunning charge to make right now, because if you read the legislation that the Democrats and the president have written, it puts a gun at everybody's head and says you must buy a product from the health insurance industry. The current health insurance industry that he says we represent as Republicans, he's forcing us to buy their product.
Well,
that's a little bizarre, isn't it?
It is a mandate to buy health insurance from these companies, and if you do that, of course, is this why health insurance stock goes up?
I guess it seems to me that if we're going to have a mandate, shouldn't we have a mandate that everybody must watch MSNBC and they can't change the channel? That's probably what the president thinks, that the government can just mandate, well, you must buy a health insurance policy from the health insurance industry. That's the way we're going to save money.
Let's go to our conservative news outlet compared to MSNBC, the Huffington Post. Sam Stein. Are Republicans, is Mr. Shadegg a wholly owned subsidiary of the health insurance industry?
I wouldn't go that I wouldn't go that far. But let's the individual mandate, I mean, if we want to have a real discussion, it's there because you need to spread out chance, basically, in the insurance industry. And if you're going to eliminate pre-existing conditions, then you're not going to be able to put premiums down unless you have everyone covered. I mean, sober-minded economists look at this, they say that's why you do it. I'm not defending it, I'm just laying out the reasons. What Anthony Weiner is talking about is why the Republican Party refused from the get-go to add an element of government-run insurance, whether it was a public option or Medicare buy-in. And I think it's fair to say that the Republican Party from the get-go said, no, we don't want that.
Is that because you oppose competition?
Actually, it's not because we oppose competition. The reality is the health insurance industry does not compete today for your business or my business. Not a single person on this set gets to buy his or her own health insurance. We get it from our employers. And health insurance companies, unlike other insurance companies, don't have to compete for our business. They don't compete on price. They don't compete on quality. Once they've convinced the owners of MSNBC what the plan should be, then they buy the plan. Joe can't hire it. Mika can't hire it. Joe can't fire it. Mika can't fire it. We're all stuck with employer-based care. If you want real competition, then change it so that I can buy health insurance at the same tax advantage basis that a business can.
That's the Wyden approach, essentially.
Well, actually, no, it's been the Republican approach from the get-go. But let me point out that how are we going to make something less expensive by forcing people to buy it? The notion behind that is, well, everybody has to buy health insurance and then it will cost less. The reality is it costs too much because there's no competition.
Well, that's the point, is that you want to set up institutions to create competition.
Go look at every
you have these exchanges, whether they're national, you have a public option.
What's the exchange? What's the national exchange for buying automobiles? Or what's the national exchange for buying suits? We don't have a national exchange for buying any of those things.
What is the
right now? Let's talk about one form of insurance. You want to do 2 forms of insurance? Auto insurance today. You watch TV any given night, you will see Geico and Allstate and Farmers and all of them pounding each other's heads in, saying one thing: buy our product and we'll charge you less and give you better service.
Geico's cheaper.
Geico's cheaper. Do you ever see that kind of ad for health insurance? Answer: never, never,
Geico's got that little green guy.
That's right. They're begging us. They're pounding each other in for competition.
Joe asked me a question, and it's why would the basis of the Republican Party continue to allow the insurance companies to fix prices? In other words, they get an exemption from antitrust. There's got to have been an argument for it if it's been around since 1945. What is the argument for that?
First of all, if it was around in 1945, it was passed by Democrats. It was defeated yesterday by all but 20 votes. That's what Mr. Weiner was talking about when he was on the floor. We repealed the exemption in the House yesterday. But why don't Democrats want to force health insurance companies to compete? If Republicans...
But they do.
Right.
No, they don't. Yes, they do. They said, let's put a public option out there and force them to compete.
If you force me to buy your product, am I competing? If we force people...
forcing anyone to buy any product.
Yes, the mandate says...
The public option would have been 6 million people tops.
I'm happy to have a public option if you force the health insurance companies to sell directly to me and give me the same tax break so that I can force them to compete on price, I can force them to compete on quality like every other business or insurance industry industry in America does right now.
John, but why don't they do that? I had a debate yesterday with Howard Dean, and Howard said you just can't do that. You can't force, like for instance, when I buy a car, I can go online.
Yep.
I got an SUV a couple of years ago, 50% off, because I found a place in New England that was desperate to. They had too many Tahoes. They were desperate to dump them. I said, okay, we're going up to Boston to get a car. Why is it that in most states, even my company has 2 choices.
Right.
And 2 choices only instead of 1,300 choices. Why is that?
As you know, health insurance, at least at the individual market, is regulated at the state level. This is why I put on the table the idea of the interstate sale of health insurance. So that if you live in New York, instead of having 1 policy to choose from, or 2 or 5, you could choose from every single policy sold across America. That would force those health insurance companies to compete.
One quick thing, though. What people will say is that if you or I can buy health insurance wherever we want to buy health insurance, there will be a pool of high-risk people that will be left out in the cold.
Why won't they have many more choices and in fact be covered? And the other answer to that is high-risk pools. We've already passed high-risk pool legislation saying to the states, anybody that can't get insured gets to go to a high-risk pool. My sister has breast cancer, and for a while she couldn't get health insurance, so I wrote legislation that says we're going to create a state-based high-risk pool in every state, and if you're either denied coverage or told you're going to be charged 200 or 300%.
Why can't we have this debate at the summit?
I know, that would be
no, seriously. Why? I don't think we've had a real health care debate. I really don't.
Yeah.
This has just been so stunted over the past year.
Yeah. Congressman, thank you very much for being with us. John Shadegg, good to have you on board. Coming up.